Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar. That is on very important topic. That is a case-based approach for immunogenic insights into summer allergies, urticaria and ocular hypersensitivity. So for this, we have very important and eminent speaker. He is none other than Dr. Vijay Varat sir. And let me share some of the achievement of sir. Sir has done MBBS, MD, consultant allergist, pediatric pulmonologist, and clinician immunologist, and consultant and Sai Allergy Asthma Eye Hospital, Shaidri Hospital, Imamdar Multi Speciality Hospital, Pune, Allergy Center. So, by taking not much time, I would like to invite sir and hand over this session to sir. Sir, the stage is yours. You can proceed from here.
Yeah, thank you for the introduction and thanks, MedTalks IGCP, for always initiating good initiatives for awareness amongst the people as well as doctors. Now, as the summer is advancing, and even in August, like the 1.5% the global warming has increased in India, and heat stroke is there. And since then only, we are seeing a lot of skin problems, eczemas, urticarias, they are increasing only day by day. And let us see now this season specifically. In Pune, there was no cold, hardly 2 3 days. Now it's so much hot. Still, it is not May. It's just the beginning of March. Still, there is a lot of hot. And then even I will start with this case. This was a young female, 34 years. Even in kitchen, some common sunlight falls on her skin, triggering angioedema, swelling of the lips and eyes, urticaria. She used to have low blood pressure, severe fatigue, and throughout the day it used to be affected. So as the summer emerges, so do the joys of outdoor activities, beach trips, picnics, for individuals with sensitive skin conditions like urticaria, hives, eczema, the arrival of summer can also bring discomfort and flare-ups. Managing these conditions effectively during the warmer months require a combination of understanding triggers, adopting appropriate skin routines, and then making lifestyle adjustments. So while we use so much skin sunscreens online and all, but they are not useful for everyone. See, each and every thumb is different, each and every skin is different. So you can't use the same whatever is suitable for everyone. So always have a good specialist experts advice, and then only you manage it. So skin inflammation in summer, if you see the heat and humidity, the allergens because of the dust particles, so many dust particles are into the air, the dust mites. Some of the places, depending on the specifically in the people go to the swimming and all the water parks, there are a lot of molds over there. Then pets, then this trigger and then ultraviolet exposure, clothing. So lighter clothing made of synthetic metals can cause friction and trap the sweat, which may irritate the skin. Chlorine and salt water into the swimming pools and that way. So depending on that, on the beaches again. So again, understanding the urticaria and eczema. Urticaria is it's called a hives or pitta bolte hai, amla pitta, sita pitta that is called. But it manifests as a red, itchy, raised welts on the skin. These welts can vary in size and shape, often appearing and disappearing unpredictably. Somebody has on the face, somebody has on the body, somebody has on the exposed areas that way. So depending on that, then again the perspiration or the sweating exacerbates these things or warmness. So again, allergens, environmental allergens as the pollens, dust mites, pet dander, and all, they provide the this susceptibility. Like many people, they must have known when they cross the Parthenium grass or something, they get a swelling and they get a itching. Then again, some of the foods like shellfish, nuts, then in India, mushrooms, drumsticks, milk, eggs, mutton, chicken, meats. And some of the medications also can trigger it. Stress, exercise, tight clothing, that also contribute these urticaria flare-ups. So the eczema is a very known like a it is basically the barrier of the skin is lost and the skin becomes very itchy, it becomes dry, there are patches, red, swollen or cracked in some places. Then again this heat and humidity they trigger it and again the allergens also even the dust mites they are in corrodes into the bed. They cross through the again already inflamed skin or the barrier lost and they get auto trigger with that. In skin irritants, infections, so many indoor pollutants, soaps, in some of the secondary bacterial infections like Staphylococcus, Malassezia furfur, they are on the skin. They again affect the hormonal changes. And then there is a each scratch, each cycle. So the people go on scratching and then again it has the problem. Then uh, impact of summer on the urticaria and eczema. The increased heat and sun exposure, it brings higher temperatures and stronger ultraviolet rays, which can irritate the skin and trigger flare-ups. Increased sweating, the perspiration can worsen the skin irritation and cause the discomfort for individuals with both urticaria and eczema. Environmental allergens, as already mentioned about that. And again, the AC use happens. So the significant AC changes the humidity into the carpet and beds and sofas. It will again has a more dust mites. Then the pigeon feather and droppings are into the on the AC outside unit or in the uh, kitchen outside windows and all. Then again have that. And again the different type of clothes also trigger that. So we should know what type of, like, the cotton clothes, the loose one, easily they should be there, and the sweat should come out rather than getting trapped inside. So how we manage this urticaria or eczema during the summer? So you can see how this urticaria looks like, the patchy one. Somebody has a smaller one, somebody has a bigger one, somebody has a edema of the leaves and eyes. Then this type of dermatitis, somebody has a contact dermatitis, seborrheic, and the scalp and all, neurodermatitis, dyshydrotic eczema because of the dehydration during these days. And these are the things like how they can trigger the eczema in these patients. So if you see this video, so this has a specific dust mites into the bed. When I had been to Denmark just in October, we had a 5 days workshop on only dust mites. So these are in crores because daily we said around 1.5 around skin. Again, the pet danders and the pigeon feathers, these dust mites are contaminated. And allergic diseases, this is the number one chronic disease in children. And if you see the pollens and the insects and these animal danders and foods and additives into the pizza burgers, again these pollen analyzers we are having. So we are collecting these molds, bacteria through the air and the pollens, and we are analyzing which type can cause a trigger to different type of patients. Even last year we had a how this atopic march or the underlying inflammation into the body continues, and then it leads to the gut sensitivity, the skin sensitivity, because the dendritic cells into the skin initially they get a sensitization, and then the gut inflammation happens because of the swallowing of these allergens inside the body and in the gut sensitivity. And after eating some of the foods, there is a cross reactivity. And that's why we have to severely prevent the further complications and sensitivity to the new generation also. Because a lot of children also I am seeing after the swimming and all, they get a dry skin, eczema and all because of the chlorine water. And then amongst while treating the exposure and avoidance measure, then safe antihistaminic like second generation antihistaminics, fexofenadine, bilastine, should be used to control the mast cells. And then, depending on comorbidities like rhinitis, sinusitis, nasal sprays, nasal washes. Like this patient, 16 year after exposure to the sunlight, gets rashes and giddiness. So, at the age of 19 years, had a 3 times photosensitivity anaphylaxis, significant anaphylaxis, collapse. She's a dental student. Now she's on omalizumab, 300 milligram. She had a severe rhinoconjunctivitis also, more problem with food and unable to take medicines on time to time also. So maintaining the cool and dry conditions. So if required, I will say natural air purifiers like a maximum trees should be there. Take a normal cool showers only once the soap can be used. Then again mild cleansing soaps or bath gels should be used. Then protecting the skin. Use the broad spectrum sunscreens. Very safe, sensitive according to the doctor's expert advice, not rather than the online one. Then clothing should cover adequately. Lightweight, long sleeved shirts and wide brimmed hats. Seek shade during the peak sunlight hours. Use maximum sunscreen after 2 to 3 hours. Again, repeat it. Identify and avoid the triggers, as I mentioned. Then specific patients do the allergy tests also, like depending on the dust mites, mango pollens, or neem tree pollens, and all. We can avoid these things and we can guide the patients on that. Then choose gentle and fragrance-free skincare products according to the doctor's advice. At the night time, use a moisturizer properly to improve the barrier of the skin. Use mild cleansers, non-irritating, and watch what you eat. Like a lot of people, they go on eating ice creams and all. Colors are there, so many. They can have a gut inflammation, Chinese, and so many spices and all. They will have that. Stress is also very important. Already, they are suffering with skin inflammation, itching, and all. Again, it causes a stress. Most of the patients have a nighttime awakening because of the itching. So you have to do some meditation, some breathing exercises, and seeking a proper medical advice. So a good dermatologist, allergy specialist, then safe antihistaminics while driving and all, non-sedative one. Then phototherapy or acupuncture. These are symptomatic relief medications. For long-term wise, the proper allergen identification, the proper sunscreen, using a proper clothes, and like while before swimming, again use a sunscreen. Good have a some precautions. The general tips like protect from the sun's exposure, avoid fragrances, manage stress, consult expert doctors, follow skincare routines. And summer can be a challenging time for individuals with urticaria and eczema and the heat. And with careful planning, proper skincare, lifestyle adjustments, we can manage with the proper specific triggers and specific precautions during these months. Now, today's second topic is a significant ocular allergy because we get a lot of patients now. Just now, as the summer has started, we get a lot of itching, rubbing, and all. It causes a different. Even yesterday, 9 years old child had been there. He had a significant ocular allergy, repeated use of eye steroids. He had previously vomitings and all in the childhood, then eczema. He was treated for the cough cold. Now he's having such a early age cataract, difficulty looking at the sunlight also. So these allergic marks should be managed. You can see how the itchy, burning, redness, foreign body sensation, heaviness, frequent blinking, unable to look at the sensitivity. So these dust mites and all, they are a very important one again into this. And this allergic march, which continues from one to one, and depending on the summer, the pollens, they are into the eyes, they go through the nose, to the nasolacrimal duct, and nasoocular reflex is there, which connects that, and then it causes a significant problem. So this was a 67-year female referred by a cornea specialist for severe itching, burning, and unable to operate an eye. So her surgery was required, but because of this cornea involvement with the severe itching, she was unable to get operated. So we use a omalizumab and then nasal steroids, then anti-inflammatory bilastine up to 80 milligram, montelukast, and some eye protector covers. She has much better. So the surface layer which has been already sensitized from these three levels, and then the summer triggers it. And then summer months, the environmental triggers as increased exposure to sunlight, pollen, dust, chlorine from the swimming pool, they exacerbate these allergies and conjunctivitis. Managing the summer trigger conjunctivitis approach has a prevention, symptom relief, and long-term complications also. So in the summer, the risk of conjunctivitis may increase due to allergens like high pollen counts are there, some mold spores at these different type of exposures. Then the irritants because of the dust particles they increase, and then the indoor and outdoor pollutants and this swimming chlorine water. So infections also, there are many patients have secondary infections. Ultraviolet exposure, as I mentioned, the ozone layer has gone down. So the proper use of goggles and all, they are very important. Use the proper sunglasses with the polar one as well as the photosensitivity prevention one, polarized ones. They are very useful. Then avoid the allergens with the nasal mask also and the eye protective eye wears. During the swimming also, they should use the eye protector. After coming out the swimming, use a nasal douching, wash the nose properly because the nasal lacrimal duct. And during the outdoor activity, when the air is there, use some mask also during that time. Maintain a proper hygiene. Don't touch the eyes that way. Keep a indoor air clean. Even if you are using a plasma clustering technology, air purifiers, or the AC should be cleaned properly. The filters as well as the tubings before the use. Otherwise, so many molds will be coming into that. So why these are there? One can get an allergy to heat, dust, and sun during the summer months. There could be also be allergies to certain pollens or organic dust at the onset and end of summer season. Spring catarrh or vernal granulate is a type of allergy seen in young boys most commonly during the summer months. So a lot of 17 to 25 years age old adolescents we have very VKC, and the artificial tears can be used. Then symptomatic some mast cell stabilizer medications like eye drops and all. Depending on that, sometimes the short-term steroids or cyclosporin drops or tacrolimus, depending on the eye specialist. So they should be visiting to the eye specialist. Cold compresses are very used. Use a clean, damp clothes, or there are some cold compresses with a very sterile one. Good antihistamine drops with the expert doctors. Then oral antihistamine is also non-sedative. Otherwise, the patient can drown into the swimming pool after the sedative one or while driving. Keep a properly hydrated. Use a good ORSs as well as the liquids regularly or juices and all depending on that. Avoid the pesticide use grapes or artificial colors into the watermelon and all. They will have a problem. Then don't rub it anytime uh, below the eyes. You can have it or use the eye drops. And minimum exposure to the smoke, strong odors, harsh chemicals. This was again 32 years computer engineer told about dry eye temporary relief with moisturizer. Now 8 months, significant photophobia, severe congestion, itching, affecting day-to-day quality of life. Early childhood, he used to rub with adolescent had a sinusitis and diabetes as a symptom. So this march continues, and then many of the patients have a dry eye because of the continuous watching that ultraviolet protector. Eye drops are also there, the goggles are there. They should be used, and the eye moisturizer should be there. So then again, these tie infections to the glands of the eyelids are also common because of the inflammation into the ear. And medically, we have to have a prescribed eye drops rather than the over the counter, because over the counter they give a very strong dexamethasone eye drops and all. They have a early age cataract glaucoma, and they will have a secondary again infection into that. And then again, it's a teamwork. A good allergy specialist, a good ophthalmologist, and then depending on that, contact lens care also should be taken. Somebody is using, because that will again have a compression onto that. And some cases, the advanced treatment as a immunotherapy or desensitization. As an allergist, we are using it regularly because it's now a common one. It's not advanced now. It's very common. So summer trigger conjunctivitis also, it can be managed very well with a combination of preventive measures, symptom relief strategies, medical intervention, proactive steps to protect your eyes from the allergens, irritants, and infections, and then concerning symptoms and persistent discomfort. A good expert advice with the specific eye drops, eye wears, then proper eye care and all, and if required, then allergy testing and desensitization can also be done to stop the progress of the disease. So that way, we should come together and we should help the patients in a good quality of life, and to prevent these summer-induced urticarias, eczemas, and ocular allergies, because they are very common during the summer. This is the most commonest diseases now. We get a lot of patients because of these things. So thanks a lot again. And if any questions, we'll go ahead with that.
Thank you so much, sir, for taking out your important time and sharing your knowledge on this topic. I definitely think this knowledge will definitely help all the participants who have joined for a better exchange of healthcare knowledge, sir. And sir, moving forward, sir, we have received some questions, sir. With all your permission, shall we take these
Yes,
questions?
yes, please. Yeah.
So the first question I can say is from Dr. Agnuhetri, and he is asking like summer is a very hot climate. So the as we know that in our country like India, like lots of patients come with lots of rashes and allergies in summer. So what can be the latest lifestyle changes play a vital role? Could you please suggest some of them?
Yeah, most important is that antioxidant or oxidative stress releasing foods are there. So vitamin C, then even like we call it aula, then citrus, lemon, and all. Then a lot of amount of liquid should be continued. Hydration is very important. Protective wears has to be there, and then maximum tree plantation should be there everywhere, because it is a natural cooling to the environment. So in the societies and into the gardens and everywhere. And then if it is required, depending on that, the air conditioners, air coolers, they should be properly cleaned. That is also very important. And naturally, like in our country, the mangoes are there. So there, the raw mangoes, there are the soups and juices are there. They are also very useful. So depending on the geographical area and all, those type of traditional juices and also can be used to reduce the inflammation and control the. And then specific one like reaching to the doctor using specific medications are helpful, definitely.
Thank you so much, sir, for sharing your expertise on this question. As we know that lifestyle is the major cause of many diseases, I hope, sir, it will be impactful to all the patients who are listening to this webinar, and as well as the physicians who has joined us to help them on their treatment too, sir. Moving forward, sir, we have another question that is related to the clinical examinations. What are the clinical examination we need to perform, like being a physician is very difficult to understand the kind of allergy. So what will be the clinical examination will be suggested for urticaria and ocular hypersensitivity to get it and better understanding?
Yeah, basically, urticaria means pittal. The people have patches and all. It is itching all, so that it immediately everybody will recognize. Eczemas are different type of lesions, and they can be depending on the age group. The childrens have on these on the limbs and all. The adolescents have at the armpits and the elbows and behind the knee parts, or at the sweating areas. The women's also underlying the breast and axilla and uh, amongst the inguinal regions, adult males and all. So depending on that, now coming to the underlying inflammatory condition, why some people have more, why not? So the we have to find out any gut inflammation, any signs are there. Then check the nose like turbinate hypertrophy, posterior pharyngeal hyperplasia, then cervical lymphadenopathy, long eyelashes, denim organ folds, dark circles, like rubbing this way and that way. So these are a type of hidden signs of inflammation. And then the family history also we should ask. Anybody in the family has a skin problems, eczemas, secondary fungal infections, sensitive skin because people understand sensitive skin. So such type of simple like dust exposure after sun exposure, after smoke exposures and all. So that way clinically we have to examine and then we have to guide the patients about the management part.
Thank you so much, sir, once again for sharing your expertise on this question, sir. One last question, sir. As we know that, sir, like all these skin kind of problems increases the decreases the that is the immunity of the person. What can be done to overcome it, sir? That is very important.
Very good question. Actually, even skin dendritic cells are there, and once the barrier is lost, the pollutants, allergens, they can cross through that, and they affect the TH to TH1 imbalance has been found, and then the respiratory infections also can increase because of these patients. So even in asthma, rhinitis, sinusitis patient also, it has been found that the skin care has to be there. Skin is a larger area of the body, so use a good expert advice, moisturizers, skin barrier improvement medications, oxidative stress reducing medications, antioxidants, coenzymes, zinc, vitamin D supplements, and all. They should also be regularly use a very mild pH soaps, 5.5 pH or something, not a toilet soaps because they will again damage the skin. So such about simple precautions, and after coming out from playing and all, at least have a normal tap water bath or something. So reduce these things. So these simple precautions also can play a very good role.
Thank you once again, sir, for answering this and sharing the insight on details on this question, sir. I hope, sir, it will be very much impactful once again to all the audience. Sir, as I can see, there is no more questions, sir. Shall we conclude this session with all your permission, sir?
Sure, sure. Thank you. Thanks a lot.
Welcome, sir. And one feedback from Dr. Ankan Nath Mukherjee, and he has written very well explained. Thanks for this amazing presentation.
Thank you.
Yes, sir. Welcome, sir. And we would like to see you in future also. As usual, sir, you are always there with some knowledge sharing with different topics in different platforms, sir. And we would like to see you again in future also with different topic. Till then, take care of yourself, sir. Thank you so much.